what were the effects of the Seguro Popular on creating jobs? I mean, self-employed people, how were they affected? How were they positively affected by these measures, the Seguro Popular?
That's a very good question, because critics of this scheme they were very keen to point out that this scheme would stimulate informality or the informal sector of the economy. Well, my response has been that, on a very basic logic of cause and effect, the informal sector of the economy has been growing much faster than the formal sector, and we didn't have Seguro Popular, so something else has been accounting for the growth in informality. And my explanation is that what accounts for that is the sort of social insurance schemes that we have evolved in the past, that have become terribly bureaucratized, and that do not provide people with enough choice to make them feel that they have value for money. We have, I now enjoy this incredible freedom to say some things I think that sometimes you can't fully say. But we have had a social insurance scheme that over 60 years has, in a sense, perverted the original sense, because by making it compulsory to utilize care from a limited set of providers, by creating a monopolist provider, has completely disempowered people to modify the incentives in the system. And it is that kind of old-fashioned insurance, which unfortunately is very prevalent in the developing countries, that is the one that stimulates people or entrepreneurs to get around it and not enroll their employees to save the cost because they don't perceive that there's value for money. Is the solution to privatize and do away for social insurance? Absolutely no. No. This was a little bit of the backlash in the post-Soviet era in some of the former Soviet republics and the countries of Central and Eastern Europe. A backlash from very bureaucratized health systems to free market systems. That didn't work either. We need to find a virtuous middle course where you have public responsibility, you create a financial instrument to have a financing based on solidarity. Remember that solidarity in healthcare means that those that are healthy at a given point in time help to finance the care of those that are sick. And it's one of the nicest principles, because all of us will end up being in the receiving end, because we all will get sick one day. So we just create a system to protect each other, to help each other at our times of greater need, which is when we're sick. So you do maintain the framework of social insurance and public responsibility, but within that framework, you empower the citizen with some of the basic elements of freedom, of choice. And then you will get, I hope, and this is what we're trying to demonstrate, a system that's much more responsive, where the incentives do reward better performance. And again, it's not simply yielding to preferences from patients. It's also objective measures of performance that you can actually carry out. So my response has been that this will actually be a stimulation to bring people into more formal mechanisms, because finally Seguro Popular is a public program, it is a formal mechanism, you are already enrolled, you are part of a societal effort, rather than the bureaucratic, old-style 19th century social insurance that disempowered people, which is the real cause of informality. So we were able to convince the Ministry of Finance that this would actually have a positive effect on formalizing people, and that's how we got this law passed.
Since 2003, when
right.
Seguro Popular was enabled, we had a 7% decrease in rotation of personnel in my plan. 7%, it's a lot.
Well, thank you.
But to be healthy. Other questions?
Right. Over here. Yes.
Hi, I was wondering if you could comment on the challenges of providing healthcare to the indigenous communities, especially that are geographically isolated, like in Chiapas and the Sierra Madre Mountains.
That's a great question. It's one of the things I didn't mention because I wanted to summarize. The law says we have 7 years to cover 50 million uninsured persons, 12 million families, but it says very clearly very clearly, very explicitly. We wrote that there, that we have to begin with the poorest people in rural areas and with special emphasis on indigenous populations. Now, again, a myth was that indigenous populations didn't believe in insurance. How are you going to do insurance for indigenous people? They have a different cultural framework. This is not going to work. This is a Western invention, and it's not going to work. It turned out that, indigenous communities have embraced the Seguro Popular because it's actually very much rooted in some of these values of solidarity, some communal values. And we have made a very explicit effort to enroll indigenous communities with a priority, and they are overrepresented in the current 22 million people who are already in the insurance scheme. It's been a challenge, but a big thing that happened in Mexico these past 6 years, now that we've entered into normal democracy, is that we changed the Constitution. And Article 2 of the Constitution, Article 1 now prohibits discrimination, any form of discrimination, which has been, by the way, the basis for a very big campaign in Mexico against homophobia and other forms of discrimination of people who are at high risk of HIV/AIDS. But Article 2 now says that we are a multi-ethnic society, and we spent, almost 200 years of independent life denying that we're a multi-ethnic society. So we now fully recognize that, and we need to have, actually we are mandated now by the Constitution to have an intercultural approach, a transcultural approach to healthcare. Now we're just at the beginning of that. That's a very tough issue, but I can tell you that there's been an explicit effort to enroll that population. Now the other issue is geographically isolated people, whether indigenous or not. In Mexico, most of them happen to be indigenous. A big part of the investment in capacity, I also didn't mention that, has been a big investment, a big push for telemedicine. I think, we tend to speak of technology, meaning vaccines and diagnostic methods, biomedical technology applied to healthcare. But we need to exploit other technologies, and particularly information and communication technologies for healthcare. We typically live in a schizophrenia. I remember going to one of our leading hospitals in Mexico City, having just opened a fantastic magnetic resonance machine, and then going down, and there was, an incredible lineup of people who were using such advanced technologies as paying someone off so that they would stand in line from 4 in the morning to keep their place. And I say, this is schizophrenic. Why the technology to develop an appointment system? It's much simpler than that imaging machine. Why don't you just devote a fraction of that and give people an appointment? But we just don't think that way in healthcare institutions. Well, the same thing would go for using the potential of telemedicine. I'm a great believer in that. I think we can really start making distance not fully irrelevant. So what we've done as part of the investment plan has called for larger hospitals in Chiapas, Oaxaca, Tabasco, and Yucatan, which are the poorest parts of Mexico. They are finished. They are the best hospitals. And the way I got the funding for that was simply to say, it's enough. We can no longer continue to think that poor people deserve poor services. We're going to make the best hospitals. I know that, maybe on cost effectiveness and considerations alone, this will not be the most cost-effective intervention, but it was important to make the statement that you would build and start building new generation of hospitals in the poorest parts of Mexico. And what we've done is they are now the nodes for an extension in those states of telemedicine to the poorest communities. So those are the two parts of the reform that have been very important. There's a question up here at the front as well. Mark?
I'm Mark Mitchell from International Population, International Health. My question is the extent to which your ability to achieve all these reforms was a function of the particular time in history that you were the minister. It was after a remarkable change of not just government but party and system in Mexico. And if that was really important, what are the implications for these kinds of changes in other countries?
Well, it's a great question, too, because we were experiencing in Mexico a worrisome sign, and in Latin America, actually, by and large, a worrisome sign of democratic paralysis and cynicism about democracy. It is critical for the future of democracy that we show that we can get concrete benefits out of democracy. I do believe this reform is a comprehensive part of the political change of Mexico, because part of the reform has been established on the basis that if you want to have a fully mature democracy, it is not enough to have universal exercise of political rights, like the right to vote, or of civil rights, like freedom of expression. You also need to have universal exercise of social rights, among them the right to health care. So actually, a lot of the political pillar was built by saying this is a comprehensive part of building a comprehensive democracy. And it's a critical part because now we can all vote, but kids are still dying unnecessarily. You still don't get the vaccines to those who need them. You still have these huge social differences in maternal mortality. What is the conclusion? And surveys show that many citizens are reaching that conclusion, is what was the good of democracy? What good did it do? So to make clear that some benefits can actually accrue from having a democratic process is essential. And one of the most satisfying moments for me was when, in the final evaluation of the government that just finished, people were asked, what do you think was the main achievement of this very unique government, which was the first government from a different party? Well, about 11% of the population said none. There was no achievement, which is not too bad, by the way. There are other governments that would do worse. But of the 89% that said that something had been achieved, the number one achievement that was mentioned was the Seguro Popular, the number one. And that's very important because it's not abstract notions like economic stability. Health is the most sensitive public service. It literally deals with matters of life and death. It creates a sensation of security in a community. Even if you're not sick, knowing that you have a place you can go in case you need it creates a feeling of safety in the community. So the fact that now this was noticed by the population, at least in these surveys, is very important. And there's a unique moment in Mexico, and that's irrepeatable, and not every country will go through that. But most countries of the world are going through a very important transition towards democratic regimes. It's one of the big mega shifts in the world order, and you see it in Latin America. Every country now, or almost every country, has democratic processes. And we need to not fall into disillusion and cynicism about the democracy, but make it work for concrete results. And this, I think, has made that contribution. So that's my lesson for other countries, even if they're at a different moment in their political evolution. There's two questions here.
Well,
Klaus Steuer, I'm with the World Health Organization in Geneva. A fascinating presentation, and I'm very glad that Lances has picked it up, and so many more people than us can benefit from the knowledge and the experience. The three pillars are important. The political one was there as a condition, otherwise things had not moved. But the political pillar will also be the one who could be the tipping point in the future in which direction is going to go. There will be threats coming.
Right.
What, in your view, should be done from the public health perspective to make sure that your reforms are going to be sustainable?
Well, very briefly, because I know we're coming to the end of the session, but the key lesson is put it in the law. If you do these reforms and just leave it as a program, the chances that it will be, of course, laws can also be changed, but right now, if the new government wanted to dismantle this, which they will not, the new government has reaffirmed that they will continue this. But just assuming, or a new government wanted to do that, they would have to change the law, which means they would have to convince a majority in the Congress. B, they would have to convince the 32 governors of the 32 states of Mexico who have signed on to the new program, to the new insurance scheme, because each state has to sign on. And 3, they would have to tell 22 million people why they are taking away this benefit that's rated as the most important achievement of the outgoing government. So you can also turn the political pillar, if by politics, in the good sense of the word, you mean not only professional politicians, but you mean citizens mobilized to defend their rights. And by putting those rights in the law, as entitlements, and making the program run well, this is why evaluation is so important, because it also serves to correct the course. I don't know everything that's happening in the field. So we're having a fantastic evaluation here carried out by Gary King in a controlled sort of quasi-experimental design, comparing communities, taking advantage of the gradual introduction of the reform to compare matched communities with and without the reform. Now, if we look at those data and we see that things are not going as well as we think they are, we use that evidence also to correct course and make sure that it is yielding the results, because that's the best insurance for the insurance scheme is to have citizens supporting it. Then it will become indestructible. But that's also politics in the good sense. Politics as the matter of citizens, not just the matter of professional politicians.
Last question.
Can we have one from our consul in Boston?
Ah, okay. 2 questions. Right.
Stephen Marks, also Division of Department of Population and International Health. Julio, my question is directly related to your final observations there. Entitlements you described as having generated concern on the part of the Ministry of Finance because of the budgetary rigidities they imply. But they also imply remedies for the beneficiaries. And you've mentioned mass mobilization in favor of the health reform. You've mentioned regulatory agencies, but you haven't mentioned remedies in order to ensure that any failures to provide the benefits that are guaranteed can be taken care of by actions taken by individuals or smaller groups that are negatively affected or do not adequately benefit from the reform. What are the remedies available?
It's also a great point. When you make them entitlements, they become demandable in the courts. So you put now the bureaucracy, meaning us, or me at least until last Friday, against the court system. But bureaucracies seldom reform themselves. You need external pressure, and the pressure has to come from several points. Part of that is citizens mobilized, but part of that is the threat that if you fail to deliver what's now in the law, you can now be taken to court. And that's a very powerful incentive for bureaucracies to do their job well, to avoid that. So we were very conscious about making that a part of the legal reform, to actually empower citizens to be able to say, this is the law says that I'm entitled to this. You're denying me. I'm going to sue you, government, for that. So it's a critical part of a democratic society, which is the judicial system. Now, the judicial system has to be reformed itself, but that's a different story that we won't go into now. But certainly, we do have an interesting solution in Mexico, which is the concept of medical arbitrage. We have a separate body that avoids a lot of the, what happens here in the States of defensive medicine, and it creates a non-court solution to a lot of these dilemmas, actually. And that has worked actually quite well. And it is also part of this package of interventions.
The last point.
Thank you very much, Julio. ¿Cómo está? I would just make a very small question. Can you tell us a little bit more on the relationship between Seguro Popular, universal coverage, and migration? Because I think one important point of Seguro Popular is the benefits do not stop in Mexico. In an integrated market as it is NAFTA, it goes well beyond that. What would be the benefits for the American economy from the Seguro Popular?
Also a very good point that you give me the chance just to mention briefly. Mexico, as you know, has a huge migration, mostly to the United States, and there is, in response to that, and again, evidence that migrant workers in the U.S. tend to be uninsured. The rates of uninsured people among migrants are huge, and then the health outcomes, of course, are much poorer. So again, if you start with an ethical framework that access to health care is a human right, which is independent not just of your labor market status, but also of your legal status in a country, then you have to do something about it. Now, I know this is not a universally accepted proposition, but I do happen to believe that should be our departure, and that's exactly what's in the Constitution of the WHO and inscribed in the walls of this great School of Public Health, thanks to Dean Bloom's initiative of reminding us why we're here for. So we developed a special strand of the Seguro Popular for migrant workers, mostly agricultural workers, in the United States. As you know, he's the consul of Mexico in Boston. As consul of Mexico, we work with the consulates of all, mostly in the U.S., to create this possibility of enrollment for migrant workers here. And that has the possibility of enrolling the families that are left behind in Mexico, and also the workers here with a special modality, particularly for catastrophic illnesses, so that they can go back to Mexico to receive treatment. Now, this can be a win-win-win situation, and we've had great interaction with the health authorities of the United States, both state level and federal. One very nice initiative has been the binational health weeks. And for the first time in 2001, and now every year since then, we have had these synchronized simultaneous health promotion activities, started in California. Last year it was almost in the 50 states, because you now have migrant populations all over. The effect of NAFTA has been that it moved the border, and the border is no longer that strip of land. The border is no longer there. That's the meaning of integration. So there is a special modality of enrollment for migrant workers, families, and for themselves. And you give me a great chance to end with 2 points. First, with migration, which is one of the big topics of the world, we need to change our paradigms of health planning. They have been based on or premised on the idea that populations are stationary, and that is no longer the case in this world. We've had concrete examples with chronic communicable diseases like tuberculosis, a binational card, but AIDS is another example. And we need to develop more of these tools to assure that literally we are able to adapt to the moving nature, the movement of population. And secondly, it has provided a great example, the health, of what I believe is another value of our field, which is that in very complex relationships like the ones between Mexico and the United States, here we find a topic where the self-interest of each of the two countries coincides with the mutual interest. And therefore, in what's otherwise a very complex agenda, for example, on migration issues, you can break through in the dialogue by focusing on improving health, which is something that benefits everyone apart from its ethical underpinning. So I continue to believe, and I think that has been the experience of these 6 years in the relationship with our migrant population, that health is truly a very powerful force to bring peoples and countries together, and that therefore it can be a fantastic tool for constructive diplomacy in this turbulent world of ours.
Julio, thank you very, very much. I can't help but end this with my favorite and probably only biblical quote, which is the book of Proverbs 29:18, where there is no vision, the people perish. Julio Frenk has an extraordinary and unique vision, and will, by his actions and vision, save millions of lives in Mexico, and I hope around the world. Thank you for coming.
Thank you. Thank you.